Wikisana, the new platform. Hello and welcome to our format, Natural Medicine. Nice to have you back. I'm looking forward to a special guest today. My guest today is Alexandra Kotthaus, Director of the Biomed Center in Sonnenberg in Switzerland. And I would like to talk to her today about the topic of ADHD. We hear or read a lot, especially in social networks, that it is an invented disease of pharmaceutical companies. We want to see what else is behind it, what is much more relevant and what is ultimately responsible. Also that this disease or this symptomatology comes to light. Stay tuned, it's going to be exciting. See you soon. Hello, dear Alexandra.
Hello, Alexandra.
Welcome again from my side.
Thank you.
You are a specialist in general medicine, psychiatry, and psychotherapy. And in this context, I am particularly happy if we take the topic of ADHD to heart. It is felt that it has been shooting out of the ground for years, and more people feel affected by it. And yes, there is always the opinion, is it an invented disease to make money with it?
Yes, to everything. When I came into the first grade, we had one. I can still remember it. It was called Zappelphilip. And that wasn't quite like that back then. At the beginning of the 80s it wasn't quite present yet. And how do you deal with it? But the children have already been there. Later in psychiatry, I got to know more and more grown-up Zappelphilips. And they also somehow had the opportunity to get through life without the diagnosis. But they may have had it a little harder than others. Or they didn't always have a school graduation. But there were more opportunities to get a job without a school graduation. And maybe not the very worst. But there were still opportunities to get by. And then you have mastered your life. And then maybe only later in life you have become conspicuous because of something. But not that it was such a diagnosis in the foreground. And these people just have it harder today. Because it is more and more important. The main thing is that you need a license to do something. To do an apprenticeship. Or to take part in other courses. And while at that time, or when I was enrolled, there was just one. Today it is, I don't want to say, a completely reversed relationship. But it's just no longer a rarity. And the topic. Even if I have teachers as patients, what they report, what it looks like in the classes, who have been in the profession for a long time now, they would also say that something has changed massively. And it is actually more difficult to get the classes under control. And there would certainly be smaller classes helpful. You could go from Huxton to Stocksken with the topic of class strengths and so on. But yes, I think so. It will definitely be more. Even if I observe small children, they are not rarely overreacting in motor skills. Also in the phase of voice training or shortly afterwards. That they are very loud. That they have their voice less under control. That they are more impulsive. And then from time to time I see a normal child. I almost want to say that. And there are also very different parents. There are parents who talk it good. And my child is just lively. And I think, maybe a little more than just lively. And then I saw a child last time where I thought, wow, I think that's normal. That's completely normal. And this child was not raised and fed normally at all. I think that the child, my children can't keep up with that either, what was best fed, what I ever got to know. And what not at all with any processed food, industrial food, milk products, gluten came into contact. And I got to know the child. They came to visit us in Sonnenberg. And he was sitting in front of such a huge plate of salad. And he ate it with a smile. And was 6 years old. And then he said something to the conversation. And he painted me a picture. And painted his hand off. And I thought, oh, finally, everything was age appropriate. Not too introverted. Also not disturbing. That was really nice. And now in the pre-discussion you said, more and more youth, you stumbled over it, more and more young people are diagnosing themselves with it. And can that even be? And maybe I want to approach it differently. If we think about the fact that we find in the blood of infants, depending on the sample and examination, 400 to 1,000 different toxins, that we are looking for 95 to 100% of the samples positive in the samples where xenoestrogen in the urine of infants is searched. Now I stumbled over a study, or an investigation, which commissioned the EU, tested teenager blood in 30 EU countries. And even there, in 100% of the samples, they found this PFAS. So we don't have to be surprised if our children are neurologically conspicuous. And actually the right word in my opinion is neurologically conspicuous, not necessarily psychiatrically. You could philosophize a bit about the terms. But most psychiatric diseases are not psychological diseases, but brain diseases, nervous system diseases. And these children, our children, are highly poisoned. And depending on what kind of poisoning they have, or maybe also what problems they have, to get toxins out. So often there are also detoxification weaknesses behind it. This also leads to nutrient deficiencies. I also know from colleagues from a few years ago, they were of the opinion that ADHD is an educational problem, because it occurs more often in socially poorer classes. But I also know very educated, also psychiatrists, who have ADHD children in my environment. And they really gave a lot in education, and tried to feed the children organically. And they have it too. And they sometimes have it less pronounced than if someone doesn't even know how to deal with it now. And the child doesn't get any good food either. Then you can certainly worsen or weaken the symptoms. But it remains that we should perhaps be aware that we are rigorously poisoning our children. And also this stupid baby food. Even in organic baby food, there are additives and rapeseed oil. I'm already weakening the liver with that. It can then detoxify worse again. Yes, I believe that immediately, when these adolescents diagnose themselves.
I have less to do with smaller children now. I also don't have any own children, but I certainly have the observation in more educated circles, as you also express it. And I also know 2 smaller children and I think to myself, were we actually so loud in the past? I keep asking myself that. When they play, it's just loud. Just loud. And excited. I can't remember our childhood, my childhood, that it was like that. That's something I notice so much. And now you're also talking about PFAS, this century poison. I also recently, that's just one group. We have a huge selection. I also recently talked to an expert here. He says he has test results of 4 patients. He examined the blood, the filtrate of a toxopherese. These substances were contained in all 4. Not only the adolescents or the children are affected by it, but also we adults. Can you still have toxicosis at an adult age?
Of course,
Still get sick with ADHS?
it's actually a random observation or a random limit. It's a childhood thing. It has simply increased in recent decades. And at the beginning, where it occurs, you probably observe that more with children than with adults. There has been evidence that adults can also have it. Adults usually get it. An adult who has never had it, or never had strong symptoms, does not necessarily get an ADHS symptom, but he gets tiredness and brain fog. If the toxins get out of hand, it's not just the toxins. This simply causes different problems in the body. It depends on which toxins and where they sit. We have different possibilities. They are not just stored in the connective tissue and that's it. They can also sit in enzymes. Heavy metals, for example, can repel minerals from the natural binding, but they are usually responsible for the function of the enzyme. Then I have a reduced enzyme function if I have a heavy metal instead of a mineral in the key function, or some receptors dock on the cell surface. Sometimes the white blood cells try to collect it. They also have a function deviation. These are chain reactions. But what is already going wrong in the child's brain is somehow tried to compensate by the child's brain. We often have highly intelligent people with ADHS. For me it is sometimes also fluent, even if it goes in the direction of autism. You can find relatively typical detoxification weaknesses in these people, and maybe others than I find in adults. For example, there is a common polymorphism relatively often. COMT, catechol-O-methyltransferase. This is an enzyme that breaks down stress hormones and also detoxifies unspecific xenoestrogens. And if I feed the enzyme with the cofactors, then the stress hormones are also broken down a little faster. And that is of course a great relief. And maybe again to the introductory sentence with the pharmaceuticals. I think it sometimes goes through the bioscene. No, it's an invented thing. And it's just because the children have too much media consumption, or maybe eat too badly. Yes, it's not that simple. Then I always think, hey, be a 24/7. Settle down, try it. But the children are usually already a baby, and at the very beginning a bit conspicuous, or scream a little more. Now I've lost the thread a bit.
Yes, doesn't matter. I listened to you so excitingly that I lost the thread too. But you just say that it's in the navel.
Oh, I got it again.
Yes, okay.
With the polymorphism. And then it is. So that means, with too much adrenaline, dopamine, it may also be that these people are particularly creative. It may be that they. So it doesn't always have to be a disadvantage. It depends on what environment they grow up in and how many toxins they have, what they get out of it. But you can also find it among extraordinary, sporty or creative people. The brain is looking for alternative solutions.
So, did I understand that right? That if someone is particularly creative, then he actually also has poisoning in the brain? Did I get the connection right now?
No. So I wouldn't say yes to that. Not every creative person is necessarily a weak detoxifier. But with the very extraordinary, I'll say. And they sometimes have health problems or something. That's not very rare.
Because that's a great effect, when someone is so extraordinarily creative, even if that also has disadvantages. Yes, thank God. but nonetheless, it's a state that you can't necessarily.
Or people who are extraordinarily resilient, who just work 14 hours and hardly sleep or something. They can go through that for a few years. Not everyone can do that. I also have a patient who knew from the beginning, I can't cope in the normal system. Then I become self-employed. And he did that very successfully. You can also use it to your advantage.
But how is it in the long run for health?
Yes, you have to do a little more for it than other people have to do. It also depends. One person has the chance to get a lot out of it. They do that. They sometimes have something like that. You could almost say they have a sixth sense. They have something like that. That's good for me, that's not good for me. Although you have to say now, such an ADHD person, there is also a high comorbidity with addiction. That means they often have cannabis. For them, cannabis is sometimes just a self-medication. Finally, I'm calm, or can think one thing to the end. Cigarettes, alcohol, other drugs may come into question. But sometimes you are so amazed, if I want that, I can stop with it. That's also there. But of course, that with the concentration you can't concentrate on one thing, that is of course a problem in school. Some can concentrate when they have fun. There must always be this effect of desire. If they find something particularly captivating and interesting, then they can also be deepened in something for hours. But not the ability that in all areas, what is now, for example, in school, where the subjects are so varied, from languages to natural sciences, then it is not always possible in all subjects to perform the required performance. Or in the extreme case, these are such high performer that they shake out of the sleeve.
What you just described, isn't that more the tendency to autism?
No, that's not the tendency to autism yet. There is also that. We have autistic people who also have island talent. That's also there. But quite often, I find, there is also polymorphism. But also mostly when you do an analysis, there is also a high toxin load. And at the moment, I'm also getting over that I'm doing more and more full blood analysis. Because unfortunately you almost always find something. Then you don't have to provoke, mobilize anymore. Actually, that's scary.
I understand that the field is actually very large. Do you get to an obvious anamnesis quite quickly?
Yes.
What exactly it is, out of these many options?
Actually, I find that relatively easy. Many people always hang on to the topic of diagnosis. And so we doctors are of course also characterized. And in order to pay the health insurance, I have to give a diagnosis. And then this idea just came up on its own. Hey, if I have a diagnosis, if I know what it is, then I can also treat it specifically. And that's just not true. And in school medicine, it's actually even less true. Then I might be able to treat it specifically, but not causally. And when I treat causes, then the diagnosis falls a bit into the background. Because the diagnosis is just a kind of upper clause of a symptom collection. And when I treat the causes, what are the causes of autism and ADHD, or other neurological things? Then you can also would be a more suitable diagnosis, neurotoxicosis. That means I have to detoxify, or chronic viral infections often also play a role, as a crosscutter. And of course the diet, liver condition, intestinal condition. But when I treat causes, then it doesn't really matter which drawer I put it in. You also say, actually, I don't think the word is that bad, when you say autism spectrum disorders. It should also be called depression spectrum disorder. And maybe it's the same with ADHD. Whether you're puzzling around now, yes, with comorbidities, there are of course higher susceptibilities also for other psychiatric diseases. And then there's this strange field of personality disorder. That's also a weird thing, actually.
Now it might be important to us that we go into a solution. You say detoxification or that you then start at detoxification.
Absolutely.
And to compensate for the micronutrient deficiency.
It is not uncommon, very typical nutrient combinations that are in the deficiency. And that you of course substitute that. Sometimes, it's just very individual. Sometimes I just refuel a little bit and already notice there's an incredible amount going on. Because if a very specific substance, not uncommonly B6, for example, is in the deficiency, then maybe it's just one part in this whole gear. But if that works again, then a lot of other processes run again. And then there are also other vitamins that might be secondary, would be in the deficiency, if you only give B6 now. And minerals are also part of it. But sometimes I refuel carefully, because I already have so much with these people now. Bring so much into play. First of all, I had 2 cases before Christmas. I gave them my phone number, because I know I could possibly bring so much into play. Or email, that they can somehow reach me if there is something, so that I can adjust there. Because with them I expect with various, but sometimes much more severe reactions. I really start there carefully. And if I can then estimate how they react, how they tick from the metabolism, then you can go further with detoxification. Nutrition plays an incredible role, of course. That's also something where in classical psychiatric education and school medicine has slowly seeped through. Certain additives in food could not be good. Sugar could not be good. That is of course the other thing, that they often have a desire for carbohydrates. A great desire for carbohydrates. And the parents are sometimes overwhelmed with it, to implement a good diet. And then you just have to say, it's just important that the right carbohydrates are. But in this case, you can't ask the child to completely give up carbohydrates. And that won't do them any good either.
I've been told to supplement the micronutrients at the same time and to detoxify. Wouldn't be that good? Because then you run the risk that you may also get rid of what you actually want to supplement during detoxification. Is that correct?
Yes, it depends on what you understand in detail among all these things. So you don't just flush out the micronutrients with any kind of detoxification. But first I have to look at what point it is, or how decompensated the metabolism is. What can it do? But I'd rather refuel, and usually that leads to a symptom improvement. And then I can detoxify it. And by now I think, hey, with detoxification I don't rush it anymore anyway, because good things last. But these people are often relatively quickly in a better condition. While it is in the school medicine a book with 7 seals, how you can treat it. And you have to say that the fewest people really react clearly to Ritalin and company. Sometimes the effects are not particularly high, and it doesn't really make sense to continue taking it. You know, if you give it to children, it can have adverse long-term side effects after years and also affect growth and other parts of the brain. But I also experience more and more that parents are sometimes forced by the teachers to medicate the children. And the solution would have to be a little different. But what it is, such a child requires both from parents and teachers a standing. They have to have a certain standing. The children are actually quite fine in their perception and perceive the vibes. And you need a standing. And that is of course a challenge for many adults. That's not something that is usually promoted during school time. That young adults come out of it who, so to speak, have a kind of standing, who have a personality. But if you have a personality, if you have charisma, then you can cope quite well with the more severe cases of the children. And that's a real task. The child always knows pretty well how the parents tick. What I also experienced in psychiatry is that when the children are more intelligent than the parents and they wiggle their fingers vigorously, or the combination, the parent is highly sensitive and symptomatic and knows what he has already done to misinterpret and his own behavior and how stupid it was at school and now tries to protect the child and doesn't want to ruin it and sets limits too late.
Is it also the case that in your practice or in your center that you treat both the child and the parents?
Not as a regular setting, but if it is necessary, then we do both. I do have a few cases where I treat parents and children, because the parents sometimes inherited the detoxification weakness, or are self-conspicuous, or because they are older and have not yet received as many toxins as a child, but still got everything a little better. And that happens.
But if you say that the parents should also have a certain standing with whom they then take their child in their hands, if I may put it that way.
Yes, but that's something that is difficult with the setting. I can try to convey something to them, but that's also actually in the area of psychotherapy to coaching. If someone needs a little more support, I already give them tips, or sometimes I introduce things to them or play with them. You are also such a kind one. Sometimes that does really good. I can see Hes already playing a little with you now. And I see what he can do.
What I learned from our conversation is that it is a huge field, and I think it is also a challenge for you as a specialist to find the right way, but also a very individual way for your patients, right?
Yes.
Yes, exactly. But it's extremely exciting to hear how you ultimately look at it and how you approach it, and that you don't get this way in classical medicine shown, especially when it comes to micronutrient support or supplementation.
Einfach nicht aufgezeigt bekommt, vor allen Dingen was die Mikronährstoffunterstützung oder Supplementierung angeht.
I think that's a part that you don't deal with in classical medicine anyway. Accordingly, you only know it when you do additional training as a doctor. If one or the other audience member feels addressed or says, that would be a great address to turn to, because so far I haven't found a good option for me and my child, or vice versa.
Noch keine gute Option gefunden habe für mich und für mein Kind oder andersrum.
Would you like to briefly tell us where you can be found?
We are on the Sonnenberg in the beautiful Schwellbrunn and have our Biomed Center there. We are several doctors and have therapy options, which are beyond regular practice. I am terribly happy to treat ADHD.
Terribly happy?
Yes, I am terribly happy to treat it.
That's good. The toxins in our environment won't decrease, so we will probably with an increase in our society.
Yes, but at the moment I'm pretty optimistic. Of course, that won't go back voluntarily, but I also experience people where I think, you can also say something positive. Sometimes I can't hear it myself, when I have to tell how poisoned we are all. For some people it's still a bit unbelievable how poisoned we really are. Sometimes I think I can't hear it when I tell it like that. That's why I like to tell it. I know so many people who work so unitedly, with so much power, also for good things in this world, which has never happened before. And I think that's why I calculated so statistically high that we can really create such a critical mass movement. But there is perhaps one more thing that is close to my heart. People know more and more. And they are looking more and more that there is no aluminum in deos and anti-caking agent in salt. And now I somehow didn't have any salt anymore, and was in the supermarket, and cooked for a birthday. I didn't have time to run to 10 stores and read through the salt. And I think, oh dear. The companies have now come to the conclusion that people always want to live more consciously or healthier. And they no longer write the names on it that they had before, but now hide it under new names. So please be careful. There is still crap in it. And so they do it with other products. So even if BPA is now free on plastic packaging, then BPF or BPS is in there. We argued with our lab. He says somehow, watch out for lab. Something is wrong with the analysis. Maybe the standard values have been raised. Yes, the standard values, the reference values for the toxins have simply been raised. And now it looks like you don't have any more.
Okay, thank you for this important aspect. Unfortunately, we just have to get to the end. I thank you at this point, but that we were able to talk in such detail about ADHS, and also about solutions that you offer, for example. Thank you very much. Until next time.
Until next time.
Also a warm thank you to you for being there. And I hope we were able to give you hope for the topic of ADHS and show solutions. And above all, also straighten where this symptomatology comes from or what causes it. I still wish you that you are careful, vigilant, and above all loving to yourself and your fellow humans. And then we have already won a lot. See you next time. Until then, goodbye.